Now, a specialist has warned that a new, diverse and modern diet is leaving people more at risk of potentially fatal allergic reactions. This comes during an ongoing campaign to make EpiPens or adrenaline pens available in public spaces.
Joining us now is Iseult Sheehan, the Clinical Director of Allergy Ireland. Hello, Iseult. It's lovely to have you here. Thank you so much. What about this diverse diet is giving us more allergies?
Yeah, so, I mean, we're seeing it, you know, every decade we're seeing more allergies. I suppose having a more diverse diet, like we're seeing, you know, people who are vegetarian and vegan, that means that you increase the amount of like nuts and seeds and things in your diet. And so we probably, based on that, we are seeing allergies to foods that we wouldn't have seen in the past. And the more food allergies that are around, I mean, I suppose the more risk of severe allergic reaction or anaphylaxis.
Now, when you're saying adrenaline pens, that's when it gets to a bad stage. But like a lot of people would be allergic to it. Maybe what would the signs be if you think you're allergic to something? What happens to your body?
Yeah, so I mean, if you have a food allergy, you generally know pretty quickly. So you eat a food within a couple of minutes, usually 5 to 15 minutes, you will start to develop, it might simply be like a bit of swelling or some hives. But the more serious and severe symptoms that we watch for are the cardiovascular and the respiratory compromise symptoms. So feeling a bit faint, a bit woozy, and that's because your blood pressure has just plummeted, it's dropped. Or feeling that you can't catch your breath, or something caught in your throat, you're sort of like that sort of sound, or wheezy breathing. And those who have asthma will often find it's a bit like an asthma attack developing. So if you have those sort of feelings of being faint or any breathing compromise, that's where you consider it, you know, that's a severe allergic reaction and you want to be using adrenaline pens.
And this is something you can develop. Doesn't mean that you're born with it. Can you develop an allergy?
So you can develop an allergy. I mean, most people, it's generally on their first or second exposure that you will, you know, as a young infant or child, that you'll find out that you are allergic. But I mean, yes, you can develop an allergy as you age as well.
But like if you're a parent, you know, and your 4-year-old has had some peanuts, you must freak out, like not knowing what's happening. Not saying that it has to be peanuts, but you know what I mean?
If they have a
the
reaction.
very first time that a child might have a reaction.
I mean, the first time a child has a reaction, it is really scary.
Yeah.
You know, it is, obviously, it's absolutely terrifying. Fortunately, oftentimes the first reaction does tend to be more so like a rash and some swelling. But I mean, that's not to downplay it either.
But what do you do?
I was going to say, so if you are getting, like if you have eaten something and suddenly you're getting that cough or you're getting that sort of slight swelling, but then it goes down, you shouldn't ignore that then. What is the next step? Would you go to a doctor? Would you go for allergy tests?
Yeah, so if your symptoms sort of settle down quickly and you haven't needed to, you know, call an ambulance or seek medical attention immediately, then the next step is whatever you think caused that reaction, avoid it for now. Get yourself seen by your GP or, if possible, by your allergy doctor, so that you can be tested so you know exactly what you're allergic to, because you're going to need to have a good management plan in place and you're going to need to avoid that food then in future.
So let's talk about these pens, because we've gotten more use of adrenaline pens. I think the brand name is like EpiPen that people will be used to from American TV shows and stuff like that.
Exactly.
So what is in these and what do you do?
Yeah, so basically the most common adrenaline pens that are used in Ireland would be EpiPen and Jexpen.
Yeah.
Okay, so they look like this. They both are the exact same ingredient. They have adrenaline in them and they have a needle inside to administer it quickly, basically through the thigh muscle is what you want to do to get it in fast. And adrenaline will essentially reverse the symptoms or the severe symptoms of allergy, or at least you would hope that's what it would do.
And you're always saying carry two. You should carry two with you, because in case one doesn't work or doesn't have the desired effect.
That's exactly it. So I don't mean one of each brand now, but like if you have EpiPen, you'd have 2 EpiPens or 2 Jexpens, and exactly that's it. So, I mean, firstly, imagine your pen was a bit faulty or for whatever reason it just didn't work. You want to have a second pen ready, or you go to give it and you feel like, oh, the drug maybe didn't go in properly, you moved your hand. But also, if you use the pen correctly, within 5 minutes of using it, if your symptoms are still there or getting worse, you use the second pen on the other leg. So some people do need more than just one adrenaline injection.
There's been a call for these to be in, like defibrillators, that we need more of these in public spaces. So, like, to have them in a lockbox that people can get to them quickly. Sports fields, like, where do you want to see them?
Yeah, so basically just like defibrillators.
Just wherever they are, kind of make sure there's an EpiPen there as well, and adrenaline.
So I mean, that's what you would hope for.
Okay.
Where do you do it? So if say if I was having a reaction now and I take my EpiPen, where is the ideal place to do it?
Yeah, so basically what you're doing, firstly, you want to be lying on the ground, and you don't need to do this now.
Right, you don't need to now, but there's always an area. Is it the
legs
leg?
in the air.
Yeah.
You take the top off, and it's same for the EpiPen. You take the blue top off. Now it's activated, and basically you're holding it like this. You don't press buttons. You're going between the hip and the knee, right into the middle area of the thigh, that sort of chunky bit of muscle, and you're pressing it down. So there's no adrenaline in this, obviously. You're pressing it down till you hear a click.
Okay.
And holding it firmly in place for the count of 10. Pull away and rub the area.
Okay.
And immediately calling an ambulance.
And this is obviously through clothes and everything, because you don't have time to be sort of thinking about anything else. So it's basically just jab it in.
So it should work through clothes. If someone was wearing very thick denim or leather or something that, you know, you were concerned with, I mean, you can always move the trousers down.
Yeah.
Or, you know.
But you just probably...
But it should go through clothes.
Yeah.
It should go through for all of that. So that's it. You hear that click, off you go, and just shove it in there.
Just hold it firmly in place, because there's a little bit of a kickback.
Yeah. And this is for people with severe allergies. So even if you've mild allergies, should you be bringing around an adrenaline pen?
If you have a food allergy, you don't know how severe your next reaction could be. So if you are diagnosed with a food allergy, you will be given
with any kind of food allergy?
Food allergy, yeah. Now, not intolerance, so allergy.
So it is an allergy. Yeah. For more information, you can go to Allergy Ireland and Dr. Iseult Sheehan, who's Clinical Director of Allergy Ireland. Thank you so much for coming in and stabbing our Alan this morning. We really do appreciate it.
Really interesting. Thank you so much.